So what are the conditions that makes it more likely to have this peptic ulcer disease after taking NSAIDs? So I think I can divide those into few groups. So there are some factors related to you, which is the patient, so patient factors. Number two, there are some drug factors or NSAID factors, the painkiller factors or analgesic factor, and there are some other factors. So what are the patient factor? If you are 60 years or older, it increases your risks of getting the NSAID-induced or analgesic-induced peptic ulcer disease. If you have a past history of peptic ulcer disease, or if you have a past history of an adverse event, maybe dyspepsia, after getting an analgesic, history of analgesic-induced any adverse event, analgesic adverse events. So those are the things that are related to you. What about the drug? If the drug is of a high risk group, so there are some NSAIDs that are increases the risk of getting the peptic ulcer disease. So if this is a high risk NSAID, a high risk drug, if the drug dose is high dose, or if you are taking it frequently, high frequency, those also increases the risk of getting the NSAID-induced peptic ulcer disease. Another risk factor could be other drugs such as steroids. Steroids themselves causes peptic ulcer disease. And if you are taking steroids and analgesics together for controlling your, for example, arthritis, then those increases the risk of getting peptic ulcer disease. So what you do, you always take the prescription at the right time, like you have to take NSAIDs at a full stomach. And obviously, before getting the meal, you have to get your typical PPIs, such as omeprazole or lansoprazole.